updates on the Boston Hope Medical Center at the BCEC. As of last night, we had 162 total patients being treated there, including 86 on the hospital side and 76 on the respite side for homeless individuals. In all, the Boston Hope has served over 250 patients. I want to thank all the folks that helped make this happen as well, because clearly it's helping us with our hospital capacity and allowing our hospitals to treat the very sick. This facility that we stood up in 5 days is able to treat a total of 1,000 people. The City of Boston has operated 500 of these beds in partnership with the Boston Healthcare for the Homeless. This level of care is possible because we made our most vulnerable residents a priority from the very beginning of this crisis. We started in March by building quarantine and treatment facilities next to our largest shelters. Then we got 172 beds in the Suffolk University dorms, improving shelter spacing. We got 70 more beds at the former hospital on Comm Ave in Brighton. We added 250 beds at the Newton Pavilion in partnership with the state. We have 50 beds for veterans at a facility in Brighton. And Boston University provided more than 75 rooms for Pine Street and staff. Because of all this work that's been collectively put in together and the supports of these partnerships, we have the capacity to shelter and treat every single homeless individual safely and be able to keep people out of the hospital system. We're going to continue to make sure this is the case. I want to thank everyone involved in that ongoing effort today. On personal protective equipment, we are continually working to source and supply PPE to our first responder in the wider medical community. Today we are starting a program of decontaminating the N95 masks used for our first responders. I want to thank all the people part of that, Partners Healthcare, and Battelle has agreed to help us in their facility in Somerville. It's going to take some pressure off sourcing for PPE and police, fire, and EMS. It's also going to ease the pressure in the larger system of the supply chain that medical systems are drawing on. So what it means is we're going to be able to take the current N95 masks and be able to clean them so they can be reused. I've heard they can be reused up to 20 times each if we have the proper decontamination.